It depends on how thick your skin is and how inflamed your skin is and what you can and cannot tolerate. And here's where your dermatologist will come in helpful, right? They can guide you as to what would be right. If you have oily to normal skin, you may be able to tolerate more exfoliation and tretinoin. If you have dry, sensitive skin or inflammatory skin, you may not be able to tolerate it.
Hi, Skin Friend. Thanks so much for tuning in to this week's episode of The Skin Reel. This week, I'm really excited to have fellow dermatologist and Mohs surgeon, Dr. Visha Patel, joining me. She is the founder and owner of Advanced Dermatology and Skin Cancer Associates in Tennessee and Mississippi. And when she is not busy taking care of her patients or their skin cancers or their aesthetic needs, she is also the founder of Visha Skincare, when she found that her patients really needed simple, multi-use, intentional skincare products that would not break the bank. And she created her skincare line in 2018. And I am so excited to have her on because as a dermatologist, as a founder and owner of a skincare company, she knows all about what skincare products we need, what's hype, how these things are manufactured, how they need to be compounded and put together for the most effective skincare. And I don't know about you, but it is overwhelming, all the skincare products out there. And it's always something new, something else being pushed or promoted. And it's hard to know whether something is hype or do you really need it. And of course, if you listen to the podcast or follow me, you know that I am actually a pretty basic, simple skincare girl myself. But yes, I like to have effective skincare. I don't want it just to be simple because I don't want to invest the time or money. I want it to be effective. And I am all about getting the biggest bang for my buck with the products and what I'm doing for my skin. So this episode is great. We are really breaking down what are your skincare must-haves, what are the nice to haves, and then what are the things that you can either eliminate or maybe not worry about so much that are maybe a little bit overhyped. So if you are wondering and maybe overwhelmed about all the skincare actives and ingredients out there, you're definitely going to want to stick around for this episode. Dr. Patel, thank you so much for being here. I'm so excited to have this conversation.
Thank you for having me. I'm excited to talk to you.
So it was a lot of fun catching up at the meeting the other week. And I love that we can now be talking. And I introduced you previously, but can you just, in your own words, tell the audience who you are, what you do, a little bit about yourself?
Absolutely. My name is Dr. Pravish Patel. I'm a dermatologist in Memphis, Tennessee. I practice probably exactly one-third cosmetic dermatology, one-third general dermatology, and one-third Mohs micrographic surgery. That's a type of skin cancer surgery. I also am a founder and CEO of Visha Skincare, so I formulated a skincare line as well.
Very cool. Well, today let's talk about what I feel like all my patients want to know, all my friends, everyone on social media, like skincare products, right? And what do we really need and what is kind of overhyped? So, are there like any top favorite skincare actives that are like must have in your opinion?
I think when, as dermatologists, we will die on the hill of you need an SPF of greater than 30 on a daily basis. Like that is your must. Now, of course, if you get beyond your 20s, which we all hope we do, we want to start including a retinol or a retinoid, in the evening because that helps with skin turnover. And as dermatologists, we are really, really gung ho on these ingredients because, first of all, we want to prevent skin damage and ultraviolet radiation and collagen breakdown. We also want to prevent skin cancer. That's very important. And at nighttime, the tretinoin or the retinoid helps as well, but it's the only ingredient that has so much data, right? So we are able to use one ingredient and produce reproducible results. And so we can tell when we look at a patient, regardless of their skin type, their sensitivity, their if it's patch of, skin color, we can tell, or gender, we can tell, okay, we're going to be able to give you this ingredient and we know what it's going to do for your skin and we know how it's going to work for your skin and it's very reproducible. And so that's why we like it. A lot of times I think there'll be hype, speaking of hype, bakuchiol, right? I mean, I have bakuchiol in one of my skincare products. We have it in our top to toe wash because it's an exfoliant and it's a natural retinol. It's actually really not. I think that's a little bit of a skincare hype. It does not work as well, but we're putting it in products because we're on this like clean beauty or we want to know we don't want to use a chemical. And so we're putting in products, but once again, like most skincare, you need to create reproducible results. And it's hard to do that when you have an ingredient that you can't quantify properly.
I totally agree. And retinoids, right? Those are the prescription ones that you get from your dermatologist. Those are the ones that are so well studied. And I'll tell people, really, this is all you need for your nighttime cream, like for the rest of your life. I've been consistently using it for decades. And I think the problem is the results can be slow, right? That people give up sometimes before they've really given it a chance. It can cause some irritation, but really, if you can stick with it, just like weight loss and exercise, if you can stick with it, the results are phenomenal.
So it's a vitamin A derivative and it tricks your skin into thinking it's wounded. So that subclinical or clinical slough that you're getting is creating collagen. And, I don't, and I, that not only addresses acne, but it addresses scars and it addresses photo aging. It helps with wrinkles. So I think that would be a must.
I agree. And the other thing about bakuchiol, I'm glad you brought that up because, yeah, everyone wants like a natural alternative, although retinoic acid and retinoids are natural, right? But the thing is with bakuchiol, I know people are saying, oh, it's safe in pregnancy. You can use them. But really, I don't know there are any studies showing that, right? It's just that it's a plant extract. And so we're assuming it's safe. But yeah, I think if you really want the biggest bang for your buck, just go for the retinoids that have been super well studied.
Yeah, I agree. And then, I'd extend that to retinol over the counter as well, only because it's baby steps. I think that if you haven't seen your dermatologist yet and you don't have a prescription, then maybe you can start with retinol over the counter. The maximum strength we can get, we have it in our serums, is the 0.1%. And then, of course, if you're not getting any peeling or your skin gets used to it, that's a good ingredient to add in a formulation to increase penetration of your actives. So if you see a retinol over the counter and it has other actives in it, then that's actually there to help the penetration. That's going to help the other actives work as long as they are symbiotic with each other. And I think it's also good for us when we use the tretinoins and the retinoids over the prescription we can use that to augment our procedures, right? We're able to use that to help us get a better chemical peel later, help us get a better laser procedure later, help us give you a better slate to put your actives on.
Yeah, great point. And I know some people are confused. Can you use a retinol with a vitamin C?
You can. However, how hard is that to put in formulation? And I know because the Visha Skincare, I know we've done it. It's in our advanced correcting serum. So we have retinol, vitamin C, vitamin E, ferulic acid, niacinamide, hyaluronic acid, and illuminonics. Illuminonics is actually a patented blend of tyrosinase inhibitors. So it's basically a lightening agent that is patented to work the same as a 4% hydroquinone. And we even put that in the formulation as well. So this is kind of like a power serum, but it's very hard to get vitamin C to stay active, depending on whether it's esterified or not, or alcohol, to get it to be active with the retinol. It's a hard formulation to do.
Yeah. Vitamin C can be sort of finicky, right?
It can go inactive. It is deactivated by sunlight. So your packaging is important. And I think let's talk about an ingredient that's kind of overhyped. It's kind of garbage alone, I think. Yay, great. Antioxidant, free radical repair. Great study showing that using it with sunscreen, right? Use putting your vitamin C on before you put on sunscreen. Great studies because that shows that it like augments your sunscreen. But if it's just a vitamin C serum, you probably are one of those people that are using other actives as well as your vitamin C serum. But I wouldn't say, oh, all you need is a vitamin C serum. I don't think it's going to be very helpful.
So, what are some of those other actives you think should be paired with vitamin C serum?
Well, I think the retinol, but you won't be able to, unless you use the Visha, but you could also use it, use it in a, not together. Like you can, the vitamin C in the morning we have a brand that likes vitamin E and ferulic acid in combination with your vitamin C because that augments the free radical release, free radical antioxidant properties to help with the damage. And I think other things with vitamin C. So if you are using an alcohol-based vitamin C and it's irritating, then you can look at using ingredients such as hyaluronic acid and niacinamide with your vitamin C because that's going to be very helpful. I think one huge thing that happened over COVID, which is interesting, is some brands came up with individual ingredient products, right? So you just have azelaic acid, you just have vitamin C, you just have hyaluronic acid. And then we're expecting people to buy these $7 to $10 price point ingredients. I'm not going to name the brands, but then they're kind of doing the chemistry at home. And I think a really, really great quote I heard is, I can give you milk, eggs, flour, and chocolate, but you're not going to make a chocolate cake, right? Like, you need it in the right formulation. You need a chemist to have done the math for you, maybe tested it. It's always nice to have clinical studies, but it's always nice to know that the drop of product that you put on your finger is going to be uniform with all the other drops that you put on your face, right? So there's not more one concentration in one area than the other. But it's also good to know that when you are putting these ingredients together, they're not inactivating each other or put in the wrong order. And that happens all the time. Countless patients will come in and they're just, I mean, they're putting their products on in the wrong order. Just a side note there, you want to put your products on from thinnest to thickest and from water-based to oil-based. You want to put your serums on first, then your creams or your lotions, and then your occlusives after that. And that's because if you do them in any other order, you won't absorb it.
Yeah, if you put like an oil-based product on first, then there's no way that thin water-based serum is going to be able to penetrate and get through.
And it happens all the time. I mean, daily, I'll have patients thinking they're doing things correctly, and a lot of times a prescription of will be included in that mix, and we have to go back and say, wait, tell me the order that you're putting it on. And it's always your serums first on clean, dry skin, so water-based products. Your prescriptions are on your clean, dry skin, because that's what you want absorbed, and then you can go up.
I'm glad you brought that up about all the single active products, right? Because it's like, oh my gosh, niacinamide, then you've got hyaluronic acid and all these different things.
Nail mucin.
Yeah, snail mucin. Yeah, what are your thoughts on snail mucin?
Nail mucin is hyaluronic acid with a couple of little, it's got a little bit of lactic acid. It's got some like a little bit of enzyme properties in it. There's nothing more special. It's a humectant, just like hyaluronic acid is.
I just can't really get beyond the stickiness and the fact that it came from snails, but I don't know.
I actually did a deep dive. I'm like, how are they harvesting this?
Yeah, I did read about that. It sounds kind of crazy. Do you want to share with us how they harvest it?
They're like, no snails were damaged in the production of this medicine, but they just like, it's not, they don't really squeeze them. They like skim them.
I got the impression they're on these like little screens and the sticky stuff is like left behind. That was sort of the impression I got, but I could just picture all these like snail farms. I don't know. I don't love snails, but I also just don't know if I love the idea of these snail farms for snail mucin. But anyways, I digress on that. But yeah, the over complicating using too many products. And then when you're using like 10, 12 different products, like inevitably you are going to mess up the order because it's confusing. Like, I'm sure I would mess it up too. So if you actually look at your products, they might already have these things in them anyways, right? Which is the better way to get it because some chemist and some, hopefully it's a good skincare company, right, has like already put these together for you.
Yes. And I think that's the part that I think is important is, how do we know when you're putting your drops of this over here or your drops over this over here that you're not putting more over here? People, like as we do with at-home microneedling, people tend to favor their right sides if they're right-handed, right? So you could be heavy-handed with your actives on your right side of your face and not heavy-handed on the left side of the face. And let's be honest, like if you're from the United States, you're photo aging on the left side of your face more than you are on the right side of your face. I think about these things.
For people listening who may not know why you said that, why are people photo aging more on the left?
Because we drive on the left side. And so a lot of times, even if we're using an SPF greater than 30 on a daily basis, we're getting more photo damage on the left side of our bodies. Now, of course, if you're from the UK or from Europe, you might be getting more photo damage on the right side of your face, in which case, if you're right-handed and heavy-handed with your products on your right side, it's great.
Yeah, there have been some like really famous photos of truck drivers, right, over the years, simply sitting in the same spot, driving, and the sun damage on the left side of the face versus the right. It's just amazing. But yeah, and I think we used to see it more in men because men tended to drive more, but now women drive. So we see it in women as well. But that's a great point. I also had never really thought about, I'm right-handed, so I'm sure I favor my right side more than my left for sure. So
Yeah, there were some microneedling studies done when people did at-home microneedling, which we can go delve into on another day, but I'm not a huge fan of that either. But people tend to be heavy-handed with their dominant hand. right? So that would be included when you're putting your skincare on your face. You would probably favor one side over the other. And so if you're using actives, that's just something to take into consideration.
Any other like favorite actives that are must have in your skincare routine?
I am a diehard azelaic acid.
Tell me more.
I mean, who says that? Who says that? Right? No one says that. So azelaic acid is actually released from a fungus. They discovered it after there's a fungus that can live on the skin or can live on the body, outside the body. And it releases something that creates hypopigmentation or lightening of the skin. And the infection that we see as dermatologists, something called tinea versicolor, but it's a tyrosinase inhibitor. And so it helps with skin lightening. But it also helps with, there's some antibacterial and antifungal properties. So if you have conditions such as seborrheic dermatitis or fungal acne, pittosporum folliculitis, these are dermatologic terms for overgrowths of a type of yeast that can be on our body, on our skin, typically our scalps and our faces and our body. And azelaic acid is wonderful for that, and it lightens the dark spots. We've incorporated that into all our serums.
I feel like azelaic acid doesn't really get the props it deserves, right? A lot of people think of it only when you're pregnant and that's all you can use, right?
But it's kind of a sneaky one that's been around for a long time, I think, that deserves a little bit of a boost.
Yeah, I'm sure its time is coming. But yeah, it's great for when you're pregnant, for acne, great for rosacea. So yeah, that's a great addition. And yeah, I don't hear that one talked about nearly as much. So yeah, usually just as like the standby when you're pregnant and can't use other things.
I know. And, it's really interesting because when you listen to dermatologists, especially on social media, I think it's very important. And they're my friends, but it's very important to look and see if it's a paid advertisement because that's a very important clue as to what you might hear as a hero ingredient. If you might hear hyaluronic acid, hy- everyone loves hyaluronic acid. Well, it's great. It's a wonderful humectant. It's a molecule that can, bind 100 times its weight in water. It's a water binding molecule. And we love it in cosmetics. Of course, we inject it all the time. We love it in our ingredients, but it's just a water binding molecule, so how active is it really? Because it washes off as fast as you put it on. It actually, because it absorbs moisture, if you're putting it on dry skin, you could be drying your skin out, right? The only way to use that ingredient is to put it on damp skin and then use your hyaluronic acid to trap the water. And then you're supposed to put an emollient on top to trap in the hyaluronic acid.
And probably people are missing that step. But yeah, we love as dermatologists, right, to put your moisturizers onto slightly damp skin because it absorbs better. And to your point, if something pulls in a lot of water, if you're putting on hyaluronic acid to dry skin, or guess what? It's going to pull out any water in your skin and just sit there.
Yeah, yeah. It could actually be drying and irritating depending on the formulation of the hyaluronic acid.
What about moisturizers? Anything in particular you like to look for in moisturizers?
Yeah. So, as a quick review, moisturizers are broken down into three different flavors. They're humectants, emollients, and occlusives. Humectants are water based molecules. We've just been talking about silyl and hyaluronic acid. Emollients are oil and water mixes, right? So, lotions would be you pump out of a bottle, creams you can squeeze out of a tube, balms you can dip your hands in and take the moisturizer out. And occlusives, that's what we slug with, the petrolums, the Vaselines, aquaphors, coconut oil. The question was, which one do I love? I love a balm, right? I like to stick my hand in the jar and get it out and put it on the skin. Some people don't like that. Some people don't like to feel sticky. I think a lot of us use both. We may, in the summertime, use lotions because they're a little lighter. And then in the wintertime, we should get a little thicker with our moisturizers. But like you said, always on damp skin because the goal of all of this is to trap the moisture in our skin.
I've noticed my skin has changed too. I used to have very, very oily skin, and I really didn't need a moisturizer. My sunscreen was enough of a moisturizer for me, but now I really do need that additional moisture in my skin. So, but I also hate the feeling of stickiness. So I tend to go with creams in the winter, lotions in the evening, but there are times where I need to slug as well.
I am having the same issue, and I've started using, and you want to talk to your doctor about this before you have you start using any kind of creams. But I've started incorporating an estrogen cream into my skincare regimen as well.
So let's talk about that a little bit because I'm seeing one of my favorite companies, Skin Medicinals, has a compounded one, and I know that people have been using this. They've been, prescribed vaginal estrogen, and now they're putting it on their face. But now,
Forever. No one's been talking about it forever.
yeah, forever. So we know it's so effective preventing dryness, UTIs, all these great benefits when it's used as vaginal estrogen. But what are some of the benefits if used topically?
Well, all of us, as we're talking right now, we're losing estrogen. So, estrogen happens to help with moisture retention in the skin. It helps with barrier repair. We formulated with Visha Skincare rejuvenating moisturizer, which has got phytoestrogens in it, and unicorn root extract, which is kind of a fun ingredient. But that moisturizer, and it's got a capital V. It says rejuvenate moisturizer with a capital V. It's for your face, neck, décolletage, and vaginal skin. Our skin changes even when we're on our periods, cyclically, right? And it happens on our face, but it happens down there too. Women will attest to that with vaginal dryness and changes in the skin down there, but no one really talks about it. But I'm glad that we're able to talk about it now. Estrogen is the pure hormone that we are putting on the skin. It's not really absorbed into the bloodstream, but we're using it for the receptors that can help retain the moisture on the skin. And so the Visha Skincare Rejuvenating Moisture does the same thing. It's got the yam extract and the unicorn root extract and the phytoestrogens. And obviously, we've done studies showing that it had no increased blood levels of estrogen in the skin. But a fun fact is when we were testing that product, when you do research and development tests, especially it's nice when you have a dermatology office and your patients can be your clinical studies, we wouldn't label the jars, right? They would just have like a number on them. And so we started giving the cream out to see if it was working. And we noticed the receptionist started complaining. She's like, Dr. Patel, your patients are coming in early and standing outside the office because they want your clinical trial cream. And I'm like, which one? What's happening? Tell me what's happening. It ended up being the rejuvenating moisturizer because you can put that on your bathroom counter without anyone knowing what it's for. So the feedback we got was it doesn't say vaginal on it. It can be my moisturizer for my face and my everything, and my husband doesn't know.
I think we're going to start hearing and seeing a lot more of it because, to your point, yeah, it's like taboo. People don't want to say it. They certainly don't want to stick a big jar that or tube that says vaginal cream on their counter. But yeah, it makes sense that if it works in our skin, our vaginal skin, that it could also work in our face, chest, décolletage, neck, all of that. So, and the fact that when it's used on mucosal skin, there's no systemic absorption. I think it's pretty safe to say, and studies like yours have confirmed that, right? That there isn't systemic absorption if you're worried about that. So it's a great option if you can't take systemic estrogen that you can still apply this on your skin. Of course, talk to your doctor first. This is it can be a prescription, right? But yeah, that it totally makes sense. And I think all these women now are finally talking about perimenopause, menopause, and postmenopause. And all these women are saying, like, come on, let's actually discuss estrogen and how we can use it for skincare as well.
Because we deserve to continue to look fabulous. Like, there's no reason why we shouldn't continue, you know, age is just a number now, right? I mean, there's no reason why we should feel bad if you need it systemically or look dull. There this can be very easily estrogen cream is usually incorporated into the majority of our cosmetic procedures if they need it, because it's just an easy fix.
And I think the days of saying like, "Oh, well, it's natural. This is just what happens." Actually, I don't think men get told that when they request Viagra, right? So it's time for women to say, "Actually, I'm not going to just accept that. I want to be healthy." And we know that vaginal estrogen actually has very important medical benefits for women. So why not also use it for our skin? I think we think of skin as just like beauty, but right? I mean, you do Mohs, I do Mohs. We know that thin skin in our elderly patients is more prone to trauma. It doesn't heal as well, tears, all of that stuff. So, yeah, if we can keep the collagen and our skin health and our skin barrier more intact, it does have medical benefits as well.
I love it. So it's evolving, right? I mean, from the medical side, we're talking about adding estrogen, we're talking about adding exosomes. We're talking about adding your own exosomes, infusions. I think regenerative medicine affects skin medicine because it's a large organ of the body, right? And a lot of times we can see illnesses and we can see so many things just from looking at the skin. I mean, that's why we went into dermatology, isn't it? We're like the best Sherlock Holmes ever. Like we can look at someone and tell if they've got diabetes, thyroid disease. You can even see if they have hypertension, like heart failure,
Lung problems, yeah, with nails.
yeah, the whole thing. Yeah, so we can look at someone and it gives us a little clue as to what's going on the inside, especially when it comes to diet, nutrition, even aging now, right? We're able to address that.
That's totally why I went into derm. I love that. What about like acids and exfoliating? What are your thoughts on that? Because I feel like I hear lots of different, on social media, and I know sort of where I fall, but I'd love for you to share your thoughts.
Yeah, so I think it depends on where you live in the world. And I think it's because some ethnicities cannot tolerate a lot of exfoliation. So their skincare, like the Korean and the Asian skincare lines, are geared on moisturization, hydration, moisturization, because the skin can be really reactive and it's not going to do well, get really red and itchy with exfoliation. I am an exfoliator, right? So I actually use a pretty strong cleanser. I use the Visha cleanser. It's got glycolic acid, lactic acid, niacinamide, tea tree oil, zinc parathione. And I use that every day. I actually don't think my skin is clean unless I've had some level of exfoliation. And I use the tretinoin, but some people can't tolerate it. So it all depends on your skin type. It depends on how thick your skin is and how inflamed your skin is and what you can and cannot tolerate. And here's where your dermatologist will come in helpful, right? They can guide you as to what would be right. If you have oily to normal skin, you may be able to tolerate more exfoliation and tretinoin. If you have dry, sensitive skin or inflammatory skin, you may not be able to tolerate it. And so that's where the whole world differs in should you exfoliate, should you not exfoliate. And, Southeast Asians, like myself, we can go in both directions. We have a high prevalence of rosacea, seborrheic dermatitis. And so some people can be really sensitive. And then some people like me, I could peel my face off one day and be okay the next.
I think that brings up a good point. Just because it's all over social media or your friends are doing it, it doesn't mean you need to do it, right? You need to figure out what kind of skin do you have and what are you trying to treat, right? If you've got very sensitive skin and things make you break out, you shouldn't be doing all these extra things or exfoliating all the time. But your friend who's very acne prone probably does need to be using like some sort of beta hydroxy acid more frequently. So that's one thing where I wish people wouldn't just, it's not like cookie cutter, right? And just because your friend did it or some beautiful celebrity, it doesn't mean you need to do it. And that's where dermatologists, again, the experts in skin health, can help guide you on whether you really need to be doing that or not.
Absolutely. And once again, even though they're all my friends, you have to make sure that if you see a dermatologist give information on social media, make sure you look and see if it's an advertisement.
And there's some areas like I know some people get bumps behind their arms, or we call keratosis pilaris, or if they get ingrown hairs, then I think using something with an acid is really, really helpful. So you may not need it on your face, but you may do really, really well to use it on your arms or your legs. So yeah, just keep in mind, like know what you're trying to treat. It may or may not be applicable to you.
I love that you said that. So exfoliants come as chemical exfoliants, which we've discussed, and then they come as physical exfoliants. And physical exfoliants could be dry brushing, scrubs, but like pumice or salt or sugar, caffeine, things like that. Visha Skincare has the fitness scrub and the sugar scrub. The fitness scrub, it's got pumice in it and charcoal, which is a natural deodorizer, and salt as a physical exfoliant to help with sweaty skin or athletic skin. And then the sugar scrub is sugar, caffeine, and it actually has avocado oil in it as well that helps with cellulite. But that would be an example of a physical scrub that you could use for keratosis pilaris or bumpy skin.
Yeah, good. I'm glad you helped bring up that distinction too, because yeah, there are different. And I don't really exfoliate my face all that much, but I laugh because I use my retinoid and to the point of flaking. So I feel like that's my exfoliant. But yeah, if I were to get some acne or some, have little bumps, then yeah, I would definitely use like a chemical, like an acid to help with that. So I love all that. Any other ingredients you think are just overhyped or you kind of are done with?
Sometimes I roll my eyes, like, I can hear my coconut oil, don't shoot me, not a fan. And, I know people love it and they think it's wonderful, but I think it's really good to eat. I think it's very healthy. It's cognitive to give you, the healthy fatty acids. But I think coconut oil, when put on the skin, is an occlusive. We talked about the moisturizers, but it also is a petri dish. So we live in a symbiotic relationship with bacteria and fungus on our skin, mites as well. And so any organism, including ourselves, likes warmth, moisture, and food. And coconut oil is food. And so sometimes when we use coconut oil on our skin, we can overgrow bacteria and fungus and actually make a problem like seborrheic dermatitis or acne or tinea vascular or any kind of overgrowth, rosacea, any kind of overgrowth that we could have on the skin. So I'm not a fan.
What about castor oil? I feel like castor oil, people are obsessed with. Like, what are your thoughts on that? I feel like I see posts that it can do everything out there. So, what are your thoughts?
I know, like even growing your eyelashes. Have you seen that? I'm like, oh my God, you're putting that on your eyelashes? Could you imagine like dyes and things that you could get?
I know we had a nurse who wouldn't use anything else except castor oil, but
It's an occlusive. It's not edible. So I usually tell my patients don't put anything edible on your body. And then I go through like coconut oil, and olive oil, and avocado oil, and almond oil, and I go through this whole thing. But castor oil is not edible, and it's been used for centuries for hair growth, right? And a lot of African cultures will use castor oil as a moisturizer for the hair and to help with texture. And it's generally not a problem as long as you don't have an organism that's growing. It's not going to make it worse, right? That and black seed oil, that's another one that people like to use is black seed oil. I think that it only becomes a problem if you have acne or you have an inflammatory condition, then castor oil could make it worse. I have my patients, and a lot of my patients are skin cancer patients. So they all have a condition called seborrheic keratoses. These are little growths that we all get on our bodies as we get older. They're moles that tend to grow and get a little crusty. And I have them put castor oil under a band aid on them. And that softens them and when they naturally slough, so then they fall off. And that's a very inexpensive alternative to my treatment.
oh wow. I've never heard of that, but I mean, yeah, and not a day goes by, right, where someone's not like, "How do I get rid of these? What are these?" So, yeah, that's a neat little hack to try.
As derms, we learn all our little pearls and jewels from our mentors that we've learned in the past, that we've been with in the past. And so that's been something that Dr. Rosenberg used to tell patients. And so I say that.
Well, good. Now I'm gonna give it a try. Well, this has been fun. I would love just to hear your top 3 tips for someone listening when looking for skincare products to buy, like, just top 3 recommendations from Dr. Patel.
I think when you're looking for skincare products, first of all, know your skin type, know exactly what you're doing, and know are you treating something in particular. So if you're looking to treat acne or you're looking to treat hyperpigmentation, then go for the ingredients for that. If you are not treating anything and you are going in and you just want to your skin's fine, you've never had issues, but you just want to do some anti-aging, then you want to definitely everybody across the board wants to get an SPF of greater than 30 on a daily basis. I prefer a tinted mineral because that helps you with hypopigmentation and the blue light coming off of screens. And we're all around screens all day long. And then at nighttime, I would incorporate a retinol, something that's going to help you exfoliate. We talked about that a little bit. And an eye cream. That would be the next thing I would say. When you apply an eye cream, regardless of what you use, we at Visha Skincare, we have one that gives you 17% reduction in fine lines and wrinkles under the eyes in less than 6 minutes. And that's because it's got caffeine in it. But when you're applying an eye cream, you want to use a non-dominant finger and gently tap. You don't want to pull on that skin. It's very, very delicate. And I always put my eye cream on before I put the rest of my actives on my skin because the actives I use happen to be very strong and they can actually cause irritation. So the eye cream actually helps prevent that from absorbing. And the next tip would be once you know what you're treating, or you start incorporating those things and maybe incorporate an eye cream. If you have any questions or you feel like you have any specific concerns, see a dermatologist and go to them early, I think, because a lot of times we see patients that have tried like spend so much money, right? Hundreds of dollars, Sephora, this, that, and the other. Also, they've done so much. And really their concern was surgical issue, right? It was too much skin laxity, too much redundancy, something that required a laser. How about blood vessels? things that we can fix so easily in the office, and it didn't require skincare at all.
I know that it always kind of breaks my heart when they come to us last and they've tried so many things. They've tried all these products, maybe even some procedures, but not really the right ones. And they spent a fortune. So, yeah, I always say, like, see your dermatologist early, right? Because we can save you a lot of the trial and error and testing out things and problems. So, yeah, that's a great. I love all those points. Really amazing. Well, Dr. Patel, I know people are going to want to find you, follow you, and see what you're up to. Can you share with us all that info?
Sure. I work in Memphis, Tennessee. My office is Advanced Dermatology Memphis. My Instagram handle is at Dr. Visha. I also have a little bit of YouTube, and the skincare line is vishaskincare.com. And I'm on all those platforms.
Amazing. Where can people find Visha Skincare?
Visha Skincare is available on Amazon, definitely on our website, vishaskincare.com, and at JCPenney.
All right. I will link all of that in the show notes so people can easily find it. And I really appreciate you being here. And I always love talking with my colleagues and getting little pearls from them. So thanks so much.
I had a great time. Thank you.
We'll see everyone next week.